Hi guys, my name is Hamza Gaj. I am a dentist currently practicing in Austin, Texas. I've been practicing for 3 years now, about 2 years. So I graduated 2018. And yeah, I recently moved to Austin in February, started in a private practice here, and I love it. It's great. But moving into a new city, going through COVID, leaving my mom, letting her go back to Africa, going through a recent breakup, dealing with a lot of stressors. I have been going through a lot of stuff personally, and that's what kind of led me to want to do this presentation for y'all, because it really kind of tipped me over the edge to realize that there was a lot of underlying factors that I was going through personally that I needed to kind of focus on myself. And it was a detriment to my overall practice, because it was kind of, it was lingering there since I started undergrad. So it's something I thought it was important to talk about with you guys, just because I think we all go through it. It's just in our profession, we're so focused on helping others and taking care of other people and striving for perfection that unfortunately we forget about ourselves in the process. And I think once we eliminate this taboo of like not talking about mental health in our profession, I'm hoping that this can kind of break that seal of making it more normal to let people know, like, sometimes you need help, and sometimes you want to talk about, your own mental health, just so you can take care of yourself before you take care of other people, right? Because it's the same thing with dating. You got to love yourself before you can love anyone else. It's just something we've always seen on Instagram, and we learn all these other ways. And I learned that from the breakup, and I think that carries over easily to this profession. So yeah, mental health and dentistry. I thought that was a cool little rhyme I got there, so I just added that in there. So we'll go to the next part. So this is a great quote I learned. It's from this book I'm reading, which is called Obstacle is the Way. And he always quotes like these great philosophers in Stoic philosophy. And it says, would you have a great empire? Rule over yourself first, which I think is so true. Like, if you want to be great at anything, you got to really be, if you want to, same thing about loving anyone, you got to love yourself first. If you want to own a practice, you got to own yourself. You got to be confident in yourself. You got to really like understand how you run yourself before you can, not own other people, but, dictate what other people can do in your practice, talk to assistants, talk to your patients. You got to really be confident and self-assured. So I think that's very important. So this is the average timeline of the dentist. So it's not perfect. I know, people like Brendan have gone through a lot more too. So that's something to take into account if you're specializing. But this is basically what you go through from start to end. So you go through high school and you figure out what you want to do. Then you maintain decent grades to get into a good college. So from the start of high school, you're trying to get a good GPA, because most of us at some point in time in high school kind of figure out that we want to do dentistry, or we want to do some kind of medical profession, right? Then once you get into a good college, you want to pick a decent major that makes you somewhat competitive to get into there. And then you want to maintain a good GPA. Then of course you have DAT coming up. You got to study for DAT, and you got to add all extracurriculars or other stuff to your account to kind of make you a bit more competitive, because you can't just do good on the DAT and that's it. You have to have good GPA, good DAT, and some stuff to kind of set you apart, like sports, leadership committees, stuff like that. Once you get into dental school, then you have to go through 4 years of the most challenging years of your life, honestly, is what most people say. It's you just basically hit the ground running, and you're taking tests almost every week. You're spending weekends studying in the library. Oftentimes you're having sleepless nights, and most other times you're in the lab working until 8 p.m., 9 p.m., trying to finish up wax ups and all this other stuff. Then it doesn't end. You graduate, you go into the real world, and then you realize you have to navigate all these other things, like you're trying to apply your dental skills to your practice, and you're trying to reacclimate to the real world. Because honestly, when you're in 4 years of dental school, you're not really in the real world. You're in this like little subset of school, and all your friends are out there working, saving up money, doing all this other stuff, living life, but you're kind of living a very like specific type of life where you don't get to experience all of that. And then you just kind of go into it with all this debt. And then you have to figure out how to live life while making a lot of money, but not knowing how to kind of maintain that money or use that money to your advantage. You're not really taught any of that. So you have to self-teach yourself that. And then on top of that, you have romantic relationships, personal relationships, family, all this other stuff. And then there's retirement or death. I don't want that to be too dark, but yeah, it's just like a nonstop thing. It just, you're just, once you start high school, from there on, it's just like it's like you're taking a marathon, right? And the reason I wanted to kind of bring this up is because we don't really realize like how we're just basically on the go from the very start. And we don't have time to think for ourselves. We're just basically thinking about the next goal and the next goal, and then buying a practice, and then, graduating undergrad, graduating dental school, doing well in the DT, all this stuff. Like there's always just these goals, and we don't have time to really like slow down and just like take a break and like focus on ourselves, right? And that sucks because it's so important in our profession to be able to be happy in the profession too. And don't get me wrong, you are happy, but I think we could be a lot happier if we just take some small steps just to take a step back and like observe what we've accomplished, and also just appreciate the achievements we made along the way instead of focusing on the next goal. So this is a perfect storm. I say like dentists have like the perfect storm of like contributing factors to anxiety, because we have certain traits and characteristics that really add to it. So obviously we're perfectionists, like we're always trying to get everything perfect. And with that comes the anxiety of when things don't go that way. So, you're always trying to get this ridiculously like unachievable level of perfection. Then once we get out of dental school, we have the financial stressors of debt, which is, we all know, is ridiculous, and it just gets more ridiculous every year. So that's something that's unavoidable. We work in very confined spaces, whether it's in the mouth or in the actual operatory room, it's not beneficial to us as human beings, because we're used to open spaces. We're used to like being in, open fields and stuff. That's what usually relaxes people. And so we spend a lot of our time in those confined spaces. We have to deal with patient fear, and we have to deal with their anxiety. So, on top of us being stressed, when we walk into a room and the patient's stressed, it's just like it's not a good environment to constantly be in, right? And then you have the physical stressors of just like constantly being tense. We're being in awkward positions all the time. When we're doing extractions, we're bent over. We're not really giving our body the necessary love and attention it deserves sometimes. And then obviously work ethic. Like all of you guys are amazing in terms of work ethic. Like from the get-go, you guys are always striving for success, and that's something to definitely respect and admire. And we don't give ourselves enough credit for it. But at the same time, we are very hard on ourselves, and that does affect us over time. Okay. So the first step is obviously identifying the issue, which for everyone that joined this, like, thank you so much for coming on. Like, it really means a lot to me that you guys even took the time aside to come on here. I know it takes a lot to even set time aside to do these presentations or like watch these when you have other stuff to do. So I appreciate it. And, good for you for actually wanting to look into this more and focus on your personal and mental health. I think it's super important for us, and you guys are, you're doing something great for yourself. So, pat yourselves on the back for that. So these are a lot of things that I've learned through my therapist, through reading certain books that I think are important for us, and also easily applicable to our profession, and things that can help us from the start. So this is for any of you dental students that are in dental school right now. I think this could really help for y'all. And that's basically just how to manage your stress and anxiety in dental school. And I didn't get to do this in dental school. Like, I had some of these aspects that I focused on, but I wish I had known all of it, because it would significantly help me through dental school. So the first thing I thought was important is collaboration over competition. I know that we're constantly trying to compete with others. Like even, to get into dental school, it's like a matter of like you trying to achieve the best scores and the best statistics possible to get into dental school. And obviously that gives you a competitive advantage against other people. So we're from the start, we're wired to be competitive. And then once we get into dental school, we always joke about gunners and everything. And, you know, some of you guys might be gunners in dental school right now, which is fine, but just try to keep in mind that when you're competitive with other people, it's going to come back to you in the future, in that you're not going to have a lot of people around you when you need the help, right? So if you can collaborate, and by collaborate, I don't mean like cheat, but try to help those around you if you can, because honestly, it's not going to put you at a detriment. If anything, it'll help you in the future. And I say that as a dentist now, because every time I collaborate with dentists or work with them, like the rewards come tenfold over. Like I get referrals for patients, I get networked into CE groups, and you know, even this job that I got in Austin, it's because I was collaborating with another dentist who referred me to these dentists who then wanted to hire me. So I promise you, if you collaborate and just open up to help others, like the rewards are going to be way better than competing with other people. Because when you compete, you're just competing with yourself at the end of the day, and you're not going to get anything out of it. And you're just going to kind of develop enemies or people that just won't want to help you when you need it. The second thing was friends and family. If you guys are really close with your family, I would highly recommend you stay close with them while you're in dental school, because they're going to be your anchors and they're really going to keep you grounded when you need it. And that's something I really took for granted while I was in dental school. And it's just, they're a great way of just reminding you that there's more to life than dental school when you need it. And, you know, just talking to your mom and dad is just such a great way to just remind you that there's people out there that love and care about you. And even with your friends, you know, like in my case, I went through this breakup and everything like that. And just talking to your friends and just having these people that remind you that there's people around you that love you and care about you and respect you. It's just these friendly reminders that just keep you going and also keep you motivated. So that's also something to keep in mind. Try not to push your friends away while you're in dental school, because even if they're in other occupations or doing other stuff, it's always nice to just keep in touch with them, because when you get out of dental school, they're still going to be around. And it's nice to have those people who are in other professions, because it's not that fun to always just have dental friends, students, right? Like you don't want to just keep talking about dentistry, even when you get out of it. So that's also something to keep in mind. You want to have like a little bit of diversity in the conversations you have outside of dental school. Take advantage of school resources. So there's counselors, and some dental schools do have therapists there, and most of the time they're free. So just keep that in mind. When you need to go talk to someone, there's people there that are paid to take care of you guys, you know. So if you're going through something really bad and you need to talk to someone and you need to talk to a professional, look into your school resources, because that's like amazing that you can just go to the, you know, a specific person that can help you with that and not have to pay an exorbitant amount. Because once you get into the real world, therapists aren't cheap. And that's something to just take advantage of while you're in 4 years of dental school. Even if you're not stressed, it's just good to talk to someone and just like let everything out if you have anything you need to talk to. So that's something to keep in mind too. The other thing is explore your city. So for any of you guys applying to dental school, any of you guys in dental school currently, I picked Chicago for my dental school. I'm originally from Houston, but when I was applying for dental schools, I picked Midwestern in Chicago because the drawing point was not the school itself, but the city. It's because I knew that when I had my free time, I wanted to spend time outside of school doing fun stuff. And I knew that I wanted to be in a city that I found interesting. And I always thought Chicago was this awesome city. I'm a huge movie buff. So just knowing that like I could like go see where The Dark Knight was filmed, or I could go see where Home Alone was filmed. Like just the idea of like being in that city that I grew up as a kid watching on TV all the time was just like a really drawing factor to me. So something to consider for you guys when you're applying, you know, like, yes, it's cheaper to go like in-state, or, you know, it might be easier to go to this school because they have whatever you like, but just take into account the city you're going to be in. You're going to be in there for 4 years. So try to realize that, you know, you want to enjoy where you're staying for 4 years at the same time, because that'll significantly help when you're not studying or not in the library. Traveling for me is a huge plus. I think it's just nice because it changes your perspective. Whenever you're stressed out in a specific area and then you travel, it kind of broadens your perspective and realize that you can get out of that tunnel vision sense where you're so stressed in this one zone and you can kind of get out of it for a bit and realize there's more out there. There's more to this life than just like what you're stressed about, right? So it's just a nice reminder that there's other things out there, and it just takes you out of that stress zone for a bit, if anything, just kind of refreshes your mind. The other thing is just remember it's temporary. Like dental school is 4 years. I know it's a long time, but when we're in there, we kind of think like, okay, this is it. Like it's all or nothing with this exam. But no, like it's temporary. Like if you fail that exam, you're not going to get kicked out. You still have the chance to like do better next time. And even when you do get the, like the warning that you're going to get kicked out or something, you still have the ability to make up for it. So nothing's ever permanent, as long as you're willing to like keep fighting for what you have, right? So don't look at anything as like the end all be all of your profession or your career or whatever. Just let you guys know, I failed the part 2 dental boards twice, and it was super embarrassing, and I was super stressed out. And yeah, I passed it the 3rd time. But the thing is, I let my anxiety get the best of me, and it sucked. But and I was embarrassed to tell anyone about it. This is probably the first time I told anyone, and I'm telling it on like a public thing. But like, it's just to let you guys know, like I'm here practicing dentistry, and I'm fine. And if anything, it made me a better dentist because I studied twice as hard. I learned that stuff like 5 times over. So like now I know that study guide like the back of my hand. And so you learn from this stuff and you come out of it stronger. So just keep that in mind. The other thing is just live in the present, not the future or the past. That's like the basic concept of meditation, is like just focus on where you at now, not like what you went through in the past, and not what you're going to go through in the future. And it's so hard to do. I still can't do it. I know I'm saying it on here, but like, just if you can just constantly remind yourself that you can't determine the future and you can't change the past. So like none of that's really going to like have any positive effect on you if you keep thinking about that stuff. So just try your best to just focus on where you're at right now and do the best you can with what you were doing right now. Okay. So comparison is a thief of joy. I feel like that should be like a motto you just stick in your head throughout undergrad and dental school, because unfortunately with Student Doctor Network and with all these dental Facebook groups, like that's all it does, is it fuels you to compare yourself to what everyone else is doing, where everyone else is at, what everyone else has achieved. And it sucks because it just puts it in your head that like, this is what I should attain because this person attained it, right? And it's not true. Like, everyone has their own path and everyone gets their own way. And some people don't tell the truth about how they got there. Some people hide minor details, like things they went through, things they failed at, the panic attack they had right before they did well, stuff like that. So just keep that in your mind. So just compare yourself to yourself yesterday. If you can compare yourself to yourself yesterday and say that you're doing better now than you were yesterday, like that's the best thing you can do. So just always try to make sure you're doing better than you were in the past. That's the only thing I can say. Self-improvement, obviously. The other thing is like, instead of comparing yourself, or like, I think when you do compare yourself to, you kind of generate this animosity or this like jealousy of someone. But if you can instead try to raise everyone around you, so if you see someone achieve something, like lift them up, even if you're like, you feel that jealousy inside, if you just compliment them and just like kind of just push that out of yourself, you can make that a habit too. And eventually that'll come naturally. And it's just one of those things you just have to keep thinking, like when you lift other people up, they're going to be there for you when you need it too. And I think positivity is the hardest thing to do, but it's the most rewarding thing. Never let anyone live rent free in your head. That goes for like your enemies, for anyone else doing good. Like you're giving them the benefit of being in your head when you could use that space in your head towards something more productive or doing something better. And I know this is all so much easier said than done, but at least once you kind of get this stuff like mantras in your head, it'll eventually kind of become a habit too. So the other thing is like, competitive spirit is good. So it's good to have that in dental school, but only with yourself. So just remember, like you can keep it in you, but just make sure you're doing it for yourself and not like to compete with the guy next to you or the gunner in your class or anything like that. So the next thing was just strategies for handling stress and anxiety as a dentist. Same thing, collaboration, competition, that never ends. So if you can collaborate with as many people as possible, like the rewards will come like endlessly. Therapy, whether you're a guy, whether you're a girl, whether you are stressed out, whether you're totally fine and you've just been fine this whole time, like just consider therapy. Like if you just want to go for one session, see how you feel about it, like I promise you it's beneficial no matter who you are, no matter what part of life you're in, no matter how stressed you are, it'll make a huge difference in your life. And it's just good to talk to someone sometimes. I mean, your friends are great to talk to, your family is good to talk to, but these licensed and trained professionals are there to kind of unwrap your mind and let you explore your thoughts and let you kind of realize why you think the way you do in certain ways. And I think that's important for us as dentists too, because we can then apply that to patients and we can realize why patients think a certain way or why patients get upset at us a certain way. And we can learn to empathize with them, because that's so important as a dentist, because it's important for us to not see patients as numbers, because they're human beings who have anxiety with us for certain reasons. Maybe when they were a kid, they had a really bad experience with the dentist and all this other stuff. So there's a lot of therapy in our profession when we talk to patients. So I think it's something we should also learn a lot from through therapy. And I think the more you go to therapy, the more you become an empath and the more you like kind of realize that you have to understand people's thoughts are a result of what they've been through their lives. And so that way you won't get frustrated at people who hate you as a dentist and whatnot. The other thing is exercise. So yoga, meditation, massages, like pretty much any physical activity that can take care of your body is so helpful. And we've always talked about that. We all know that just having endorphins coming out of your system is such a huge benefit. So I know in dental school, it's a little harder. Like at least you have like a bit more of a routine and schedule. But once you get into the actual practice, it's even harder because, you have meetings and you have to go do life stuff, like get groceries and do all this other stuff. So it's like, if you can take the time aside every day to at least just do a 1 hour of something, like that's better than nothing, right? So just try to focus on that. Same thing for friends, associates, family. Just try to be friendly with everyone. Try to have a good network of friends and just try to surround yourself with good people. Make sure you don't surround yourself with toxic people or people that can affect you from a productivity standpoint, and also just emotional standpoint. If you're with people that are always negative, it's not going to help you. If you're with people that are always complaining, it's not going to help you. So that's another thing to consider is once you're in this profession, you want to be with people that are driven and motivated. If you're with people that aren't driven and love to party and love to do, non-productive stuff, it's going to affect you mentally and professionally. So that's something to really take into account. That goes for your romantic interest too. For traveling and taking breaks, same thing. You want to disconnect yourself every now and then from your profession. You don't want to burn yourself out. That's such a huge thing. Like I burned myself out basically. Like I worked throughout COVID and I worked through the last 4 months without taking any breaks, and it really caught up with me. And it wasn't until I took that week off to just go hiking that I realized like, wow, I have not like taken any time to myself, and like the effects are significant and you don't realize it until it's too late. And so you never want to get to that point. The last thing is hobbies. Like us as dentists, the thing I love about dentists in our profession is like we're freaking like nerds, and like we're so passionate about the most random shit. And I love it because like I have some of the most interesting dental friends like that are into photography or movies, and like I'm obsessed with Star Wars and music, like all this stuff. So it's like it's awesome that we have so many hobbies that we can all kind of vibe with and talk about outside of our profession. So don't ever feel that you need to sacrifice those hobbies for your profession. Like if anything, bring those into your profession. Like I moved to Austin because I love music and I love art and stuff. So this city is perfect for that. And I talk about that all the time with my patients, and it helps so much when patients are anxious or nervous or stressed out, because as soon as I walk in there and play Tame Impala or I play something and they're like, oh my God, I love Daft Punk or Tame Impala. And it's like, you can just vibe with them. And now they don't see you as a dentist. They just see you as this guy that happens to want to get in your mouth. And, it's like, you remove that like that awkward discomfort or anything like that. They realize you're a human being. So that's something to take into account too. All right, the benefits of meditation. Meditation is the hardest thing in the world, and I'm still like struggling with it. But if you guys can start now in dental school, like it's going to make such a big difference in your life. And I'm still working on it. And I can tell you guys, you're lucky now that you have a lot of these things through apps that make it so much easier, like guided meditation, which like weren't available back in the day. And it's just great. Like it really helps you just kind of retrain your mind to think in a more efficient manner and in a more productive way for you. So I put some apps on here on the left side, which is the ones that I recommend that I've tried in the past that have been beneficial. I currently use Headspace because I just feel like that's the easiest and most like developed one. There's even like Netflix has like a Headspace like streaming thing, which you can actually like watch it on Netflix, which is cool. And it'll like guided meditation for you. So like if you're studying and you just want to take a break and instead of watching a Netflix show, just watch one of those Headspace episodes and just sit there and relax. And it's just cool because it walks you through it, because meditation is freaking hard sometimes. And it's nice when somebody's just telling you like what to think or how to walk through it. But yeah, the benefits of it, it reduces your stress, it controls your anxiety. It enhances self-awareness, which is so important, just to know like why you're thinking the way you're thinking or what you're thinking. It enhances your attention and focus, which like you guys know is so important in dentistry, because sometimes I know like I'll be doing a filling and my mind will just start wandering, and it's sometimes not a good thing because you can forget what step you're at and all that kind of stuff. So just being able to like know why you're thinking what you're thinking and just kind of realize like most of your thoughts in your head are just thoughts and nothing more. And so it's important for us as dentists to realize like sometimes we overthink things or we over rationalize things that we don't need to. It actually improves memory, which has been shown in research. So that's another beneficial thing to know for any dental students. So if you meditate before you take your boards exams, that could help a lot with all that route memorization you guys are doing. It reduces blood pressure. So like I said, hypertension is one of the leading causes of health issues in dentists. So, just doing meditation can definitely help that. It's accessible anywhere. Like you can literally pull your phone out, put your AirPods in and meditate wherever you are and just start it. And the last thing is it's free. You can, if you don't want to use these apps, I mean, there's free apps, but if you don't even want to do the apps, you literally just have to just sit there in silence and just try to meditate yourself. And that's harder, but I mean, that's the matter of fact is you don't need anything. You don't need equipment. You don't need a yoga mat. You don't need any special stuff. You just need to be present in the moment and just focus on yourself and just try to meditate. The benefits of therapy. So like I talked about before, like I said, you have to learn to love and care for yourself before you can love and care for others. That applies to everything from relationships to families to being a dentist and being a healthcare provider. So importance of lowering your blood pressure, you develop better coping strategies. So the biggest issue I've had is like understanding why I react certain ways to things. Like, I used to have, I feel like I have like a anger issue when I play soccer. Like on the field, I have an anger issue, but off the field, like I don't really ever have that issue. And it's a matter of like trying to figure out like why you are that way. And, talking to a therapist is so nice because it gives you like this idea of like, maybe like as a kid, you went through this or that. And it's nice to unwrap these things and kind of figure yourself out. So when you are in the moment again, you can kind of rationalize why you're reacting that way and how you can be better about it. And the other thing that, even like in just talking to patients, it helps you understand why a patient hates dentists, or you kind of empathize more with why they're so nervous to be there. Because I know sometimes it's frustrating because you're about to do this extraction and then the patient just freaks out and has a panic attack. And you're like, oh, this just like ruins my day now because like now I can't do this extraction on this patient. But we have to like step back and think like, hey, this is a human being. They probably had a really bad experience in the past, and like maybe I can talk to them and kind of figure out like what's going on and how I can like help them cope with it better. Self-reflection, same thing, just kind of like, you're able to kind of identify your thoughts and your thought processes and why you're thinking that way. the ability to work on and improve self-damaging personality traits. So, we're dentists. Sometimes we can be assholes, and it's important to realize that when we can, because when you do go into practice and you have assistants and you have people working for you, you want to be better about this. And I'm not good about it. I'm still working on it because I can be pretty introverted at times. And so I have to work on like being a little bit more enthusiastic and out there, and, just being able to work on this with your therapist and realize like how you can be better about approaching it and stuff like that is important. Same thing on that, improve, understand, and communicate better interpersonally. And then empathy, like empathy is so huge in our profession. It's so important. I feel like it's the most underrated thing in our profession. Like we talk about hand skills, we talk about dental technology, we talk about all this shit, but like, if you don't care about the patient, then like, you're not going to be a successful dentist. And like, that's the truth, because the most successful dentists I know are the ones that are so passionate about just helping people. And those are the dentists I know that are like there's one dentist I know, and he told me his secret to his success is that he gives all of his patients his personal cell number after all of his surgeries. And he calls them the next day after their surgeries just to check in on them. And I think that's like such a small thing. And it's kind of crazy, like just giving your personal cell number to these patients, like it could be crazy, but like he cares about them so much that he wants to make sure they're all doing okay, whether it's a minor extraction or a major one. And he's killing it. And I think that's like, just like that small example of empathy has such a huge impact on his overall success as a dentist. And it's not his hand skill, it's not his appearance, it's not his practice, it's just how he is with his patients. I put this up here, I think like if I'm talking about mental health and I'm talking about anxiety and depression and everything, I think it's important to have this up here. So there's no stigma behind this. I think if you ever feel like you need help or you need to talk to someone, like take this down, just keep it in the back of your notepad, just keep it in the back of your journal, just like keep it somewhere, and just know that there's always someone there to talk to if you need to. And if you just want to, just take the time aside to like self-reflect and just realize that like whatever you're going through, as hard as it is right now, there's always a finish line, and it's always over at some point, and it gets better from there. So it's not the worst part of what you're going through, and it significantly improves after that. So don't ever give up, no matter what point you're going through. These are the books that I've recently read that were really helpful for me. And I'd really like to share them with y'all. So if you want to write these down or look at these later on. So this one is great. It's called Don't Feed the Monkey Mind. And it's really good. It just basically mentions how there's basically a monkey mind in you that is the part of you that causes the anxiety. So whenever you're just sitting there and all these like crazy thoughts come into your head about thinking about the worst case scenario or anything like that, it's this monkey mind, and it's just about retraining this monkey mind and realizing that it's just a small portion of your mind that you can dominate and retrain and basically not give so much control to. So just something to think about. The other one is Mind Over Mood. It's basically cognitive behavioral therapy, which is a type of therapy, and it's a journal. So like if you guys ever journal, I highly recommend it. Just every morning or nighttime before you go to bed, just journal, write down whatever you went through, whatever you're thinking, just put all your thoughts onto a book, close that book up and put it away. It helps a lot. If you don't want to do that and you want more of like a guided version of it, Mind Over Mood is kind of that. It basically just has like pre-written stuff that you can fill out. And it kind of it does the same thing like a therapist would do. It just kind of opens up your thoughts and kind of makes you approach things in a different way. The other thing is Jordan B. Peterson's 12 Rules for Life. I have not read that yet, so I can't really give you any input on it, but it's called The Antidote to Chaos, and it's the same thing. It's just basically simple rules that'll just help increase your overall, not success in life, but just make you a much more highly functional person by kind of removing that anxiety and replacing it with ways to be more productive with yourself. Ikigai is awesome. It's a Japanese term, and it's basically talks about how you can integrate your profession and your life together and make them both, a rewarding aspect of your life. Like basically all of like your job, your role in society, your happiness, all of that should be integrated together. And it's basically what carries you to keep going and doing things. Like you don't want your profession to be on one spectrum and then your personal life to be on the other spectrum and just have it all disconnected, right? Because that disconnects your mind and everything too. So that's the other thing. And the obstacles away is really good. It's basically Stoic philosophy talking about how every challenge you face, everything that stresses you out right now is part of your growth. So you're going to go through it. It's going to suck, but ultimately that's what's going to make you come out stronger at the end. So just look at every obstacle as like something that is necessary in your life. And if you didn't have it in your life, it would make you weaker. So, you know, having these challenges, face every exam I did bad on and I failed, like that boards 2 exam that I failed. I'm so happy I failed those. And it sounds so stupid to say that, but ultimately it made me such a great clinician and provider now, because I can go through any like chaotic aspect of dentistry and not freak out because I've already been through the worst. So like, I'm not worried if like a root canal fails or something like that, because I kind of like went through the worst with having a panic attack about the boards 2 exam and all that stuff. So it kind of just teaches you that, you know, you come out stronger with every obstacle you face, and it's a matter of just retraining your mind to look at those obstacles in a different way. All right. And then last thing was real strength lies in the control or domestications of one's emotions, not in pretending they don't exist. So that's the same thing as, you know, we're all stressed out. We all have anxiety. It's nothing to be ashamed about. Depression is nothing to be ashamed about. It's there. And it's not a matter of like just tucking it away in a box or putting it away. It's more about, you know, identifying the issue, focusing on it, and working on it, just like we do with cavities. We identify a cavity, we know what class it is, and we know how to approach it in terms of correcting it. So same thing with our mind, you know, like we just have certain cavities, we just have to like pay attention to and try to take care of them as best way possible before they turn into root canals or possible extractions, because you don't want to do that on your mind. So yeah, that's about it. I want to say thanks again for you guys being here and joining me. It really means a lot to me just to be able to like share this with y'all, and for y'all to even like think that I'm special enough to be talking to y'all. So I appreciate it.
Thank you so much for your presentation. I don't know, I know you planned this whole presentation was great, but we do have questions if you don't mind answering them. Do you want to answer some questions that we?
For sure. Sorry if I went over time. I don't know what
No, it was great. It was really great. Yeah, we just like wanted to open up the floor to anybody who had any questions. I know this is like a really like not taboo topic, but it's like it's clearly not something that's talked about. So like for anybody that like wants to unmute themselves, feel free to keep yourself unmuted or just like interrupt any questions that we have. But like we are gonna ask a few questions. So yeah, the first question, what was it, Sarah?
Yeah. So just like in dental school, there's a lot of I mean, you have classes from 8 to 5, and then you have to study with the rest of your time. So how do you actually carve out the free time to, like you said, like go and travel in the city that your dental school is in, or exercise or anything like that?
I would make like a routine. So like I would kind of schedule blocks out of my day. Luckily, I lived so close to dental school, so it wasn't that hard. And the gym was attached to the dental school, so I could just go to the gym between like library time. So I would like schedule like, I'm going to study from 5 to 7, and then I'm going to go from 7 to 8 to work out. Then I'm going to go back to the library after, and like just things like that. And then for going to the city, I would like make sure I had time on the weekend to go to the city, whether it was for like an hour just to get coffee and sit somewhere, or whether I could walk around for a day or two. And luckily I had my girlfriend at the time who was also always down for that. So we would make an effort, like at least to go to the city. Even if it was early morning, we would go there, we'd grab some lunch, breakfast, do whatever, walk around the city, find some new store we wanted to check out. And then we would go back, you know, and start studying like in the afternoon, or we would study at the library in the city. Like Chicago had some badass libraries and badass coffee shops. So like, it's just a matter of making an effort to go out there and do it, because you have the time. It's just more so of like pushing yourself to get out of the comfort zone and doing it, because if you don't, you're going to regret it looking back and be like, why did I spend 20 hours in that library when I could have gone to this library in Chicago, which is like a historic monument, like if you're in a city with some cool spots, like you can go study there too, and at least enjoy the environment you're in. So just try to make the effort to block out some time for yourself and consider it mental health time. Like people take time for physical health. You need to take time for mental health. And I don't think like taking time to watch Netflix and stuff is bad necessarily, but I think like you can't spend all your off time just watching TV and like playing video games and stuff. Like it's nice to go walk around and get some fresh air and enjoy the place you're in, because then you can talk about those experiences when you get out, like I'm doing right now, which I'm so happy I can do. So.
All right, awesome. So our next question for you, Dr. God, is so a lot of students that come into dental school are like type A personality, like very competitive, want to do it all.
Yeah.
So what do you suggest specifically for students who struggle with getting critiques or failing at a task?
So that's where, like I said, those books were really helpful to me. The Monkey Mind one talks literally like, here, I'll just pull up the notes. Like it talks about the 3 traits of the monkey mind. And the 3 traits are, sorry. So the 3 assumptions are: we have an intolerance for uncertainty, we have a perfectionism trait, and we have over responsibility. Like we feel like we need to achieve everything possible, right? And those are the 3 main traits for having an anxious personality. And those are literally the 3 traits I feel like every dental student has. So like it comes standard in us. Like we want to be perfectionists and we want to do great and stuff. And you can still do all that stuff, but it's more a matter of like realigning your expectations and being more realistic about your outcome choices, right? So like realizing like you're not going to make the perfect wax up, like you're not going to achieve the perfect oral surgery unless you're Brendan, but like in most other cases, like you'll probably, your suture technique won't be the greatest, but you can achieve greatness regardless, right? So it's more about just realigning your expectations, and it's just a training method. Just like you work out and you do all these things, you just have to retrain your mind a different way. And if anything, you become better, because that way you're more confident in your outcomes without expecting these like unachievable outcomes. So highly recommend that book. I think it'll really help in verbalizing what I just, or reading the script, reading what it says instead of what I'm verbalizing right now, because mine's everywhere.
Okay, the next question I think we have somewhat like relates to the question that was just asked in the chat, but so now we're on to being like a practicing dentist. How often do you find yourself stressed at work? Do you find yourself just as stressed as you used to be when you're in dental school? Like, is there a different type of stress that you experience now?
Yeah, it's definitely a different type of stress, but I mean, stress is stress at the end of the day. It's about like managing your time, which we all deal with in dental school. It's about, speaking to patients and speaking to like your associates, just like you would your student partners. So you deal with similar stresses, just in different ways. And yeah, you're just as stressed in the real world as you are in dental school, if not more. It's just that we kind of expect that once we're out of dental school, like things are easier because we have more free time to do other stuff. But you have other responsibilities that are also important outside of dental school, like finding an accountant, knowing how to like organize your money better and not making stupid choices and all that kind of stuff. So I think it's more about just realigning your expectations again and being more disciplined in your approach to handling stress factors. And it's okay to be stressed out, but it's more about how you react to those stressors than not being stressed out. Like everybody's stressed and it's natural to feel that way, but it's important to like take a step back and realize what the appropriate way to respond to it is.
Speaking of responses, I have a really good question for you, Dr. Gaj. I think we can all relate to this, where we had that exam that we were like studied for, we thought we had it under control. You go into it, you come out, you find out that you failed it, or you got the C when you needed a B plus. After that, how do you recuperate how do you recover that mindset back to like, you know what, it's just one exam. It's not the whole course. When you get in that funk, you're like,
Yeah.
Oh my God, I'm going to fail the whole class now. How do you bring yourself back to the core and be like, Like, what's that number one thing you found to work for you?
So this is the other book I was reading, The Obstacle is the Way, which, like I said, like I just consider those as being obstacles for me to just be better at what I'm doing. And so um, one of the quotes is like, to do great things, we need to be able to endure tragedy and setbacks. And we have to find love and joy in everything we do. Everything that happens as a consequence, good and bad. So the way I started to look at it is like, okay, I fail this, but that's just going to motivate me to do better the next time, or just going to motivate me to like prove to myself that I can do better the next time. Because sometimes we get overconfident or we get a bit cocky, and it's good in that way, because this is stupid, but in The Dark Knight Rises, Bane starts beating up on Batman and he says, victory has made you weak. And it's true, because if you just keep passing things and if you just keep doing good, you're gonna become weaker in a way, because you just expect everything to go one way. And it's over time, the more you hit those successes, that one moment you're going to get a setback, it's just going to throw everything off, right? Whereas if you fail every now and then, it's kind of like a nice little reminder to humble yourself and to keep yourself focused on what you're doing, and to not get lazy, and to not like expect every outcome to go perfectly. It's good, because even when I failed, the boards, it's like, I know now what it feels like to fail, and I know now what I did wrong to prepare, like how to prepare differently. And so even when I go into surgeries now, like I'm overly cautious about checking the patient's medical history. I check their blood pressure. Like I take every step possible, because I know what that failure felt like, and I know how to avoid it this time. Doesn't mean I don't hit failures along the way, but every time I do hit that failure, it's just another reminder now to add it to my list of what to check before going in there.
All right, so our final question we have lined up for you is, what's the big relationship between mental health and oral health? So, like the cause effect, like two-way connections.
Oh, there's like anything going on in your head has such a significant effect on the rest of your body. And I mean, there's a crazy story out there. I mean, it's actually a real story, but I can't give you the exact source. But like, this girl was so stressed out that she was pregnant that her body started reacting in that way to show pregnancy signs, right, and symptoms. And her stomach even like expanded, like all this crazy stuff, and she wasn't pregnant. And it's like, it just shows how your mind can have such a drastic effect on your body in such a crazy way. And that's why I think it's important that we address mental health and how important it is in our life, because we focus so much on our physical health in our world nowadays. We have all these awesome workout apps, we have all this stuff out here, but I feel like mental health is still kind of in the back burner in terms of like being an important part of our life. And I think it's nice now that people are now more interested in therapy. And I think COVID really like was a catalyst for this, because people are now being locked in their homes and realizing like, okay, like now all I can do is sit in my thoughts and realize how messed up my thoughts are and stuff. And so I think it's huge. And that's why I'm doing this, because I think we spend so much time going to CEs and all these midwinter meetings and all these like dental gatherings talking about awesome dental equipment and dental techniques, but we don't talk about like how we need to take care of ourselves in order to be the most efficient and productive providers out there. And if I have to be like one of two dentists talking about it, like I'd be happy to, because it's definitely had a significant effect on me. And like these last 4 months have been the most stressful, anxious times of my life. And yet I'm surrounded by like great things. Like I live in Austin, this amazing city. I have, a nice like apartment, and I have all these like great things in my life. And yet I was still dealing with anxiety and all this stuff. And it just shows how sometimes you can't control that state of your mind. And so it's important to focus on it and realign yourself, so you can appreciate things more and be a better provider out there.
All right. I think that was our last question, if no one else has any other questions. But I just wanted to thank all of the people who came out to attend this event, and thank you especially to Dr. Gaj for speaking on this topic, since I believe it's our first event on mental health in the dental field, and I feel like it's just so refreshing to hear that. So I just wanted to thank you to come and speak.
Thanks for having me. It was awesome to be here, and thank you all for taking the time out of your day to listen to this. I know it's not like the most exciting material, but at least you guys know we're all in this together. And if you guys ever need to reach out to me or DM me or something, I'd be happy to talk about whatever you guys want to.